Hi everyone, my name is Neinjay and I will be presenting a case study on Mycoplasma pneumoniae, which is an important cause of atypical pneumonia. In this presentation, I will explain the microbiology of the organism, how it causes disease, how it was diagnosed in a real patient, and how it is treated and prevented. I will also walk through a severe clinical case that demonstrates how this organism, although often mild, can sometimes lead to life-threatening complications. The main objective of this presentation is to first describe the pathogen Mycoplasma pneumoniae, including its classification, the structure, and what makes it unique compared to other bacteria. Next, I will summarize the clinical case by reviewing the patient's symptoms, history, and how the disease progressed over time. I will then explain the diagnostic methods that were used to confirm the infection, including polymerase chain reaction and other laboratory tests, along with how these tests work. After that, I will discuss treatment and management, focusing on antibiotics used, their mechanism of action, and their supportive care required. Finally, I will evaluate prevention strategies and the public health impact of this organism. Mycoplasma pneumoniae, typically found in young adults, is a bacterial pathogen, meaning it is a prokaryotic organism that lacks a nucleus and a membrane-bound organelles. It belongs to the genus Mycoplasma and is classified within a unique group of bacteria known as molecules. One of the most important characteristics of this organism is that it is the smallest known free-living organism with a very small genome and limited metabolic capabilities. It is a major cause of atypical pneumonia, also known as walking pneumonia, because patients may initially have mild symptoms and continue daily activities. One of the most defining features of Mycoplasma pneumoniae is that it does not have a cell wall. This means that it lacks peptidoglycan, which is normally found in bacteria cell walls. Because of this, it cannot be classified as a gram-positive or a gram-negative, and it does not appear on a gram stain. Instead, it has a cell membrane that contains sterols, which provide structural stability. This is unusual because most bacteria do not contain sterols. The organism is also pleomorphic, meaning that it can take on different shapes, and it is extremely small, allowing it to pass through filters that typically trap bacteria. Mycoplasma pneumoniae causes disease primarily through its ability to attach to respiratory epithelial cells using a specialized protein called P1 adhesin. This attachment prevents the organism from being cleared by mucus. It also disrupts the normal function of cilia, leading to a condition called ciliostasis, where the cilia stops moving. This results in mucus buildup and impaired clearance of pathogen. In addition, the organism produces reactive oxygen species, such as hydrogen peroxide, which damages host cells. Finally, much of the damage seen in severe cases is due to the host immune response, which can become exaggerated and lead to inflammation and tissue injury. Mycoplasma pneumoniae is transmitted through respiratory droplets, meaning it spreads when an infected person coughs or sneezes. Humans are the only known reservoir, so the infection spreads from person to person. The incubation period ranges from 1 to 4 weeks, which allows the infection to spread before symptoms are even recognized. It is especially common in crowded environments such as schools, dormitories, and military settings. This organism is responsible for approximately 20 to 40% of community-acquired pneumonia cases, making it a significant contributor to respiratory infections worldwide. In this case study, the patient was a 19-year-old female and a college student who was previously healthy with no known medical conditions. She had a recent history of travel, which may have increased her exposure risk. Initially, her symptoms suggested appendicitis, which is important because it shows how this infection can present in unexpected ways or delayed diagnosis. The patient initially presented with fever, abdominal pain, and vomiting, which are not typical respiratory symptoms. However, her condition progressed rapidly, and she developed respiratory distress with difficulty breathing and decreased oxygen levels. As her condition worsened, she required admission to intensive care unit and eventually needed mechanical ventilation, indicating severe respiratory failure. This rapid progression highlights how unpredictable this infection can be. Clinical and lab findings showed that the patient had bilateral infiltrates on chest imaging, indicating inflammation in both lungs. Laboratory tests revealed an elevated white blood cell count, which reflects an immune response, and increased C-reactive protein levels, which indicate inflammation. Arterial blood gas analysis showed acidosis, meaning there was impaired oxygen exchange. These findings confirmed that the patient was experiencing severe pneumonia, affecting both the lungs and the overall body. To diagnose the infection, several tests were performed. A PCR testing results showed positive, which confirmed the presence of Mycoplasma pneumoniae by detecting its genetic material. The cold agglutinin test was also positive, indicating the presence of antibodies associated with this infection. Blood and respiratory cultures were negative, which is common because this organism is difficult to grow in laboratory conditions. PCR test works by amplifying small amounts of DNA, making it possible to detect the organism even when it is present in low quantities. Serological tests detect antibodies produced by the immune system, with immunoglobulin M indicating a recent infection. The cold agglutinin test works by detecting antibodies that cause red blood cells to clump together at low temperatures. Diagnosis is challenging because the organism cannot be seen on a gram stain, and its symptoms overlaps with other respiratory infections, requiring more advanced testing methods. In this case, the patient was treated with azithromycin, which is a macrolide antibiotic and the first-line treatment for Mycoplasma pneumoniae. She was also given levofloxacin for broader bacterial coverage. Oseltamivir was initially administered because a viral infection was suspected before the diagnosis was confirmed. In addition to antibiotics, the patient required supportive care, including oxygen therapy and mechanical ventilation due to severe respiratory failure. Let's discuss the mechanisms for the treatment. Macrolide antibiotics such as azithromycin work by inhibiting protein synthesis. This means that they bind to 50S ribosomal subunit and prevent the bacteria from producing essential proteins needed for survival. Fluoroquinolones work differently by inhibiting enzymes involved in DNA replication. Beta-lactam antibiotics are not effective against this organism because they target the cell wall, which Mycoplasma pneumoniae does not have. In severe cases, additional treatments such as corticosteroids may be used to reduce inflammations caused by the immune response. Despite treatment, the patient develops severe complications, including acute respiratory distress syndrome, which is a life-threatening condition involving widespread inflammation in the lungs. She also developed multi-organ dysfunction syndrome, affecting multiple organ systems, and myocarditis, which is an inflammation of the heart muscle. Unfortunately, the patient died after 7 days. This case demonstrates that although Mycoplasma pneumoniae often causes mild illness, it can occasionally lead to severe and fatal outcomes, just like this case. So let's discuss prevention and public health. While there's currently no vaccine available for Mycoplasma pneumoniae, we can still take preventions, which heavily relies on good hygiene practices such as hand washing and covering when you're coughing and sneezing, which is essential to reducing transmission. Isolation of infected individuals can also help prevent outbreaks, especially in crowded environments. Public health awareness and early diagnosis are important because timely treatment can significantly improve patient outcomes. I hope that this presentation helped you learn a little bit more about Mycoplasma pneumoniae, and thank you for listening.